Good morning, YouTube friends. It's Dale from whatever the weather may be. I'm just sitting up here in my studio this morning doing a bunch of different things all at one time as usual. This is what I do. I'm knitting on a pair of socks here that I started. And I'm writing a blog and I'm having coffee. But what I'm really doing is I just can't seem to get my mind off of a book that I read this weekend. This book right here, The Unfinished Child by Theresa Shea. I have to tell you about this book because it calls to me as a woman. It calls to me as a mother, as a nurse. There's so much about it that has remained with me even after I finished the book. I went to bed last night and I laid there for a long time thinking about what I had read, and I highly recommend it as a reading, as a good read. If you can find this book in your local library, read it. It's quite an eye-opener. And in a way, for me, it wasn't an eye-opener, and I'll explain that. So this book, The Unfinished Child by Theresa Shea, is a story about three women, Margaret, Elizabeth, and Marie. The story opens with Margaret in 1947 giving birth to a baby girl who is, the minute she's born, is identified as a mongoloid. Now, mongoloid is a term we don't hear anymore, but in the 40s, 50s, 60s, mongoloid was the word of choice for Down syndrome's children. And the title of this book, The Unfinished Child, is actually correctly identified as one of the terms that they used to use for mongoloid children way back in the day. They called them unfinished children because back then they considered these children to be not completely developed before they were born. And indeed, some of them weren't, but in particular, they believed that their brains were not developed, or sometimes they had missing limbs. Certainly, they never ever believed that their sexual organs would be properly developed. And so the term unfinished child was given to these mongoloid children. So Margaret, in 1947, delivers a mongoloid little girl. And at that time, women didn't have much of a choice. It was, when you delivered a child like that, it was pretty much suggested, or almost even demanded, that the child be put in an institution. Nobody took these babies home back then. They were considered to be, well, actually, most of them back then probably didn't even have much of a lifespan, to be honest, but they were something that nobody wanted to have. They didn't believe that anybody could look after them correctly. So what they did was, you signed release papers, you never saw your baby, and they took the baby away and put them into an institution. And that's exactly what happened to Margaret's baby. She was taken to an institution. And this book is actually set in Edmonton, Alberta, Canada. So she was taken to an institution where retarded children and mongoloids and all undesirable type births, who had physical and mental challenges, were put. And for the first 10 years or so, or maybe even 8 years, I can't remember exactly how many, but Margaret had no contact with her child. And she had 2 other children. She had another child a year later, which was normal, a boy. And then a couple of years after that, she had another baby girl. And so she had a family, her husband and her 2 children, herself had made a life. And they pretty much never considered the child that was in the facility, the institution. Her guilt, however, led her to go and see this child. So when she went to see the girl, the conditions at this institution were horrible, beyond horrible. And so she would visit once a month to see this girl. And even though there was no way that she could communicate with her, the girl couldn't speak, she maintained her relationship once a month to see her daughter until she was 16 years old. The other 2 women in the book, Elizabeth and Marie, are written in the year 2002, so they're modern women. Elizabeth is married and has not been able to conceive a child after trying every conceivable method, in vitro and all that kind of stuff. Marie is married and she has 2 daughters. Marie and Elizabeth are best friends, have known each other from the time they were young children. And the story, I don't want to give too much of it away because you should read it, but it goes full circle, and I won't give it away at all. The only thing that I will tell you is that Elizabeth is adopted, and Marie, in her 30s, becomes pregnant and discovers through normal prenatal testing that she is carrying a Down syndrome child. So that sort of can tell you more about the story, but read it. It's a good read. And as I was reading it, there's so many parts in here that I could identify with. I could identify with the institution part because as a young nurse in the 70s, my first nursing position was actually in an institution, not for Mongoloid or Down syndrome children, but for post-polio patients. And although it was not a bad institution, the care was excellent and everything, I often think that millennials nowadays would be horrified to even think that people lived in an institution in the way that the post-polio patients had to. They too were struck down in their prime. They were young people in their 50s. They got polio. They became paralyzed from the neck down. Some couldn't even swallow. And they were put in an institution for their care. But they never came out. They never left that institution. They died there 40 years later, some of them. Some of them died, within a few months of being there. But when I was there in the 70s, these people had been there since the 50s. And that was their home. And it is a different thing that sort of anybody who was born in the last 25 years, even 30 years, probably would have a very hard time dealing with the true fact that there are people who do live in institutions or who did live. It doesn't happen much anymore. Nowadays, we have so many medical advances that these kind of things don't even occur anymore. Not in our countries. Maybe in third world they do, but not here. And so young people of today have no clue. And I'm sure they would be horrified, but I think they have to understand times were different Medical treatments were different. People were different. There was not a lot of options for people back in the 50s and the 60s to care for people who couldn't care for themselves. So getting back to the post-polio patients, I could identify quite well with the feelings that Margaret had when she went to see her daughter. Hers were guilt because she had to put her daughter in there. But although the situation, the institution was totally different from the one that I worked in, it was the same feeling. You feel very guilty when you see people who cannot leave a facility ever, especially when you can go home at the end of the day to your family. You can go for a car ride, you can go to the park, you can go fishing. It is a very heartbreaking feeling when you leave them. So I thought I would show you how some of the people that I looked after lived. I don't know if I can get this picture clear. This is Ray. And this was his excitement for the day. Sitting in his chair with his respirator on. And now that was a respirator in the 70s. It was a big shell that was strapped to the chest, and it had a big suction hose on it, and it was attached to a motor, and it pushed the chest in and pulled it out. That's what I'm talking about. There was no special equipment that you could hook yourself up to. And Ray wasn't, this was only what he wore when he sat up. At nighttime, he was in a rocking bed, on a rocking bed, which breathed for him. As the bed went down, it pushed the air in, and as it came up, it pushed the air out of his chest. Some of these patients were in iron lungs. What did I do with that picture? Charlie. To the right of Charlie there, you can see the iron lung. Same idea. It breathed for a patient. The only part of the body that you could see in an iron lung was the head. It stuck out of the end here. The rest was inside of that can. And that was Charlie's iron lung. That's how he slept. And when he got up into a chair, he frog breathed. And I can't explain frog breathing to you because it's too weird. But what they did, there was quite a few patients who could frog breathe, which is what they were doing was sort of swallowing air. And they developed this themselves. So this is how he could breathe, by frog breathing. He didn't wear a respirator, but at night when he was sleeping, he couldn't breathe on his own, so he had to be in this iron lung. Now, when they were in the iron lung at night, all us as nurses could see was their head. But if they had to go, say they had to use a urinal, the men, you would unlatch the side of the iron lung, and there was a bed, and it was on wheels, and you would pull it out. You'd give them their bottle, you'd pull it back in so that they could breathe. Because once you open that iron lung, they couldn't breathe. So it was a challenge to nurse these patients, but it was also, I can't tell you what a wonderful bunch of people they were. They were great. They absolutely were great. Now, there is, this one is not very clear, but this is Bert. He's on a rocking bed. He never ever left his rocking bed. And a lot of these people, because they had been paralyzed at the time of getting their polio, and because they couldn't get off a rocking bed, or they couldn't get out of an iron lung, they couldn't sit. Their bodies wouldn't bend anymore. They were like a board. And so this was the case of Bert. He never moved. He could move his head, and that was it. The rest of his body was completely flat. He couldn't sit. So, you know, people nowadays, they would think this was just a horrible, horrible thing. But this was their life in their institution. So this is why I do understand the story of Margaret, because so much of what Margaret saw and felt, I can totally identify with that. Now, the rest of the story between Elizabeth and Marie, their friendship, they had known each other since the time they were young girls, had gone through a lot of different scenarios in their life. And some of it was good, some of it was jealousy, some of it was anger, some of it, just like, I could so identify with that as well. Because if you've known people from the time you were very young, you realize that as you go through stages in your life changes and your friendship changes, because your friends may be having a different set of circumstances than you have. And so every conversation in there, I could so imagine myself as one or other of them. And I could so put other friends of mine in their places. It was a very moving book. And although I'm not sure how accurate the descriptions of the institution were, they described a horrible, horrible place. Perhaps places like that did exist. I don't know. I never saw any places like that. But the rest of the book was very true. And it was something that I believe some young people of today should read. I often wonder where today's younger generation get their ideas from. You know, they haven't had the challenges that generations of the past have, and yet they seem to know everything about it, and they're very critical of how things were done and how people were and how people talked and how they believed. And I think it's very easy to have those ideas and those thoughts, but I also think that you're becoming very ignorant if you just follow the path of denial about what went on before, because that is life. Times change, people change, situations change. And I think it's wonderful that some of these things, like polio and Down syndromes, are totally different now. Hopefully there is no paralytic polio anymore, ever again. But again, a lot of people do not want to vaccinate their children, and there may come a time, if this kind of idea continues, where you will see iron lungs and rocking beds and respirators and people who cannot bend happening again. This is the truth. The same goes with Down syndrome. There's testing now for Down syndrome. People don't have to have Down syndrome babies. But it doesn't mean that it's eradicated. It has not been eradicated by any means. It has been accepted. couples make a choice when they are faced with the decision of whether or not to bring a challenged child into the world. Many do, many don't. But it wasn't all that simple back in the 1940s, 50s, and 60s. So that's what's been on my mind today. And like I said before, it's a good read, and it's something that I can totally identify with on so many levels, and has really made me think a lot about where women have gone in the past, where they're going now, and where medical science has gone and is going. If you can find the book, read it. It's a real eye-opener, and it's a good story too. The ending will surprise you. It was very well done. I highly recommend this book. So now that we've had this little chat, I think I'm going to put some gardening clothes on and head outside to the garden. I have beans to pick and beans to freeze. And here I have a heel to work on. And a day to get through. So, I wish everyone have a great day today. I'll talk to you real soon. Bye for now.